Hi, my name is Chris Runde. I'm a principal consultant at Baruzzini, and I'm here with my colleague, Mark Crosby. And today we're going to be talking a little bit about 9/11 and how we can learn some lessons for today's current crisis with COVID-19. To start off, maybe, Mark, would you be willing to give us a little background on your work in airports and beyond?
You bet, Chris. I've been in the airport industry for over 23 years as an airport executive, and the last 4 years as a consultant with Ross and Baruzzini. I got to work at two different airport systems, a large hub airport and a medium hub airport, both that had general aviation and corporate airports at it. And also been very fortunate to work in several areas within the airport management world, operations, real estate, and then public safety and security. I'm an accredited airport executive. I worked extensively after 9/11 with the airport trade associations and still am involved with them, serving as the chair of the security committee for the American Association of Airport Executives, and currently the chair of the security committee for Airport Consultants Council. And also I've had a parallel career in the Air Force. I currently serve as the Assistant Adjutant General for the Oregon Air National Guard, where I've focused a lot on emergency management and response.
Awesome. So you mentioned to start that you had 23 years as an airport executive, and I'm curious, what was the focus of security before 9/11, or how did the airport operate before that happened?
Yeah, well, it was different than what we've come to know post 9/11. It was kind of a lesser area of responsibility for the airport and for the airlines. The airlines in general were responsible for the screening of passengers, and the airport was responsible for the access, getting in and out of the restricted areas. It goes back to where airport security started, which was in the 60s and early 70s, when there were some hijackings, and they added metal detectors to screen for weapons. And in the early 70s, the FAA created a regulation for airports to be responsible for the access control and the airlines for the screening of the passengers. And that went along until the 90s and the first Gulf War, when there was some added measures done. And for example, ticketed passengers were only allowed past the checkpoint, and some other infrastructure measures and access control evolved from just a flash pass kind of system to an electronic system. And then we came to 9/11.
Yeah, I mean, it's sort of fascinating to think back that flash passes were accepted, considering where we are now. And, one of the things everybody can remember is where they were on 9/11. I was on a golf course. I'd be curious, what were you up to and what was happening specifically sort of at the airport with the leadership and government? Sounds like there was a lot of moving pieces.
There was. We stood up our emergency operations center. Everything just stopped, and it was like a ghost town, a lot like we've seen lately in the last few weeks. So there are a lot of parallels. The focus, though, became right away to get people back in the air and get them comfortable with travel. So that similarity is the same as what we have today. The big difference, Chris, was that there was a clear and known objective and a clear known threat, and that was people trying to blow up airplanes or take over airplanes. We don't have that same known threat today that is as easy, because the virus's attack aspects are different and unknown. So after 9/11, we focused on enhancing the screening. The prohibited items list became more extensive, and we posted the National Guard in the airports. And a lot of that was just to make the people comfortable, having uniformed people with weapons to assure them that they were safe from a terrorist attack.
Yeah. And so this is predating TSA. The federal response was still percolating. People were still trying to figure out what the appropriate engagement is. And ultimately they did get involved. I'd be interested to hear, from an airport perspective, how did that come down? What were your observations
Right.
as an operator?
Yeah. Most airports didn't have security departments. It was an additional duty within your operations and or police departments that were there. And so right away, a lot of airports created security departments. That's what we did. We added police staffing to address the additional needs of security, meaning tightening down on the airport and having a larger presence at the airport. So there was a lot of infrastructure that was added, more screening machines, the mandate to screen check bags, which didn't exist before. That caused for a lot of planning and infrastructure challenge to add screening machines where they didn't previously exist.
Yeah. Was that on your own dime? I mean, how did you find funding for basically a brand new arm of the airport's operation?
Yeah, so right after, 2 months after 9/11, which is really fast in legislative terms, Congress passed the Aviation and Transportation Security Act. In that, it created a TSA, but it took the TSA 12 to 18 months to stand up as a new organization. So the FAA stayed in charge of security and worked with the airports and the airlines to enhance the existing screening and infrastructure changes. The biggest mandate in there, besides standing up the TSA inside of the ATSA legislation, was to screen all checked bags. And those mandates came down initially with not a lot of funding. And then the government hired big, large defense contractors to help airports put in the screening devices initially, which they did fund, but still there was a lot of additional unfunded things going on along the way, like the addition of police forces, the creation of security departments. So what the lesson learned there is that they brought in defense contractors that weren't familiar with the airport environment. And I think going forward, that's one of the big takeaways that we need to think about when we make changes to the new normal here post-COVID, is bring in contractors that already know the airport environment and that work with airports.
Yeah. When did that become obvious that maybe we had missed the mark by having groups that were unfamiliar with aviation sort of calling the shots or being responsible? Was it
right away?
Yeah. Okay.
Yeah. I know at my airport, we had a contractor come in and who was not familiar and wasn't listening real well because they had their deadlines to meet. And we had to have them removed and reassigned because they needed to listen to what we had to say to make this system work of baggage screening in a short-term manner. Yep.
And so I suspect, though, you probably replace that guy with another guy who may not have been familiar with aviation. So there's probably a learning curve either way. And, the wild west of TSA starting up turned into the new norm. What did that new norm look like from your perspective?
Well, again, TSA had a monstrous task to stand up a workforce of 40,000 people in around a year. And so that's hard. That's not easy. And a lot of the people who they hired did not have any aviation background either. So just like the contractors that we had to educate for the immediate deadline of 100% bag screening by December 31st, 2002, as the TSA came on board, we really had to work with them to educate them on what they were supposed to be doing, both from a screening and a regulatory standpoint. And that was what the goal that I always gave my staff is, we're going to know more than our regulators, but let's help them along the way because our goal is common.
Yeah. And you mentioned that TSA did bring some funds to the table for the equipment and other items, but you as an airport operator still had costs incurred in all of this as well, right?
Yeah, a lot of the infrastructure costs for that immediate deadline were on us. After the 2002 deadline was met, when a lot of the screening machines were put in the ticket lobby area, airports immediately pivoted to building a long-term solution, which was putting X-ray behind the scenes down below the airport. And those systems cost a lot more, in the tens and hundreds of millions of dollars. And that's where the federal government at first stepped up to fund 100%, then 90%, then 75%. And as more time went on, it became less and less to just the screening equipment. So their airports were jockeying to be the first in line to get that funding. And now, 15 years or 19 years later, when these pieces of equipment need to be updated and recapitalized, the funding is almost solely on the airport and the airlines.
Interesting. And I think we bring up the example of people that aren't familiar with aviation. This is a very interconnected world between our government, the airports, the airlines. when it comes to finances and operations, it's something that needs to be thoughtful, so that you realize that there's a tail to the dog, right? You can set something up really quick, but is it going to be something that you, for the long term, who owns it, who absorbs the costs, who maintains the operations? And again, maybe there's some parallels to what we're observing now and some of the conversations about what the government's role is.
Yeah, airports and airlines really are linked together, because what most people don't realize is that, airports don't take general fund monies from their local tax base or from the federal government. They almost solely rely on user fees, and 50% of those user fees come from the airlines in general across the aviation spectrum. So most capital projects that airports do over $1 million or so, the airlines usually have some sort of vote or say in approving it going forward. So when the federal government comes down with unfunded mandates, it's critical for the airport and the airlines to work together to figure out what solution they are going to do to meet that mandate.
Interesting. And there are many stakeholders in the airport, as you know, so this sort of has a ripple effect to the concessionaires and any other entities that are working there. And I was wondering a little bit, and thinking back to TSA, lines, I don't think were as big of an issue before 9/11, security lines, but it did become a concern. I think in general, the traveling public doesn't always differentiate between where TSA starts and the airport stops and vice versa. How did you manage those challenges that were sort of out of your control?
Yeah, the checkpoint area really isn't owned by any one entity. The TSA and the airport and the airlines all have a stake in it. We used to call it, no man's land, that area, and we all had to deal with it. So, for example, we were regularly reconfiguring the lines at the checkpoint, like literally almost every day. When you think about all the changes that were being made to the prohibited items list and making the lines longer because the screeners were taking longer to find stuff, and the customer didn't know what to expect because it was changing so rapidly. And that's a lesson learned for going forward with COVID. We have got to have a consistent message to our customers to get them comfortable to fly again. And if we add health screening or anything else to the checkpoint process, we need to do it consistently across airports all over the world, and also so that the customer can be prepared, knows to expect when they get there to expedite the process.
Interesting. Yeah, I mean, I think the reality is this is a network, right? It's not just making sure that your airport is secure. It's where that passenger is going next, and then vice versa. I mean, you also, as an airport, want to know who's coming into your facility on a plane, and that they're properly. But I think that to the confidence point, communication is going to be critical for us to get back to the volumes. What other obstacles do you sort of foresee for us?
Because this threat is different, a health threat is different than a physical security threat. It presents some real challenges. There is no clear federal entity right now that's in charge of this. This is a health issue, and this is a security issue and a safety issue. So that would mean that the TSA, the FAA, and CDC under HHS would all need to provide input in this. After 9/11, we could go directly to the FAA because they were clearly in charge of security, and then the TSA. That's not the case now. Historically, health screening has not occurred at airports, so HHS or CDC have not had a clear role ongoing with airports. I think the solution for infectious disease type threats like this has got to be something that isn't permanent, that needs to ramp up when there is a pandemic or a perceived threat, and then ramp down.
Yes.
To do that, we have to figure out where the health screening goes. And it's not necessarily at the checkpoint, but it may be. That's the kind of hard policy decisions we need to make, and then make them consistently across the whole aviation spectrum.
Yeah, there's two thoughts. I think that's excellent. There's two thoughts that come to mind from previous work. On the TSA side, I worked a little bit on risk-based security. So it sounds like a risk-based approach based on what the threat is And then the other one is the innovation side, where you need to be flexible, future flexible, and be able to adapt. And I think it sounds like a heavy-handed federal approach would have a tail, and it may not be the exact right approach for this particular situation. Um, and you mentioned earlier traveler confidence. I mean, how do we get our head around the various challenges? Because we talk about the passengers, but to reopen and to get back, I think there's going to potentially be new norms for employees and anybody that's working in the airport. What are your thoughts on making this a safe environment for airports?
This is a difficult issue because it's very complex. It's not just simple. We're going to screen more to find weapons. It's more complex than that because again, the threat is not is multifaceted, is not singly faceted.
Yeah.
What we need to do is set a goal and agree to that goal. If the goal is to make the traveling public more comfortable for screening, then we have to accept some risk with that. And then the industry needs to come up with specific national policy needs that then Congress can draft legislation with. We didn't have time after 9/11 really for legislation, the people who drafted legislation to really engage with the industry because of the perceived threat and need to move quickly.
Yeah.
Now, we also want to act quickly, but I think we need to engage the industry input first on what the policy issues are so that Congress can write the right laws so that then the federal agencies can draft the rules for it. And again, there's no single lead federal agency in this case, so we need to work through that a little bit and probably broaden the authorities of a federal health screening type entity, not only for aviation, but for other modes of transportation too.
Yeah, I was going to ask you about that. I mean, it's really, that's where the network really expands is, how do the other modes of transportation and other venues tie into that? But I think that may be a good question for our next call. So I wanted to thank you, Mark. This was a great conversation. I feel like we've scratched the surface and we'll be back for more. But, some of the things that resonate from your points are the importance of industry collaboration and having people on the ground that know the realities of how airports work. And then the idea that we need to be cognizant that there's a tail to this. Whatever we set up at a national level will need to be maintained if we're future flexible either way. Any other parting thoughts?
So you've hit them pretty good. Let's work together. Let's set a clear goal and let's understand the impacts of our actions to the customer, because ultimately we all want to feel comfortable and safe when we travel.
Absolutely. Awesome. Well, thanks a lot, Mark. I'll talk to you again soon.
Thanks, Chris.